Good evening. My name is Chris Thornley. I am the chairman of the Board of Health. Today's date is December the 8th, 2021. We are getting ready to start the meeting for the December meeting of the Board of Health. This meeting is being recorded and will be available to the public in compliance with state law. If you are attending remotely, please remember to mute your microphone unless you are speaking. Anyone participating remotely should state their name and title, if applicable, at the outset of each occasion that such person is speaking. All votes taken which any member of this body are participating remotely shall be taken by roll call unless vote is unanimous. The chat feature will not be utilized or considered during this meeting. Please allow me to introduce and confirm all those members and staff that are present and can hear me. I will be asking for each participant to identify themselves so I can just check everything off. Nancy Baralt.
Here, present.
Okay. Chris Davis.
Present.
Okay. Nancy Porter.
Mary Porter, present.
Excuse me. I apologize, Mary. And Michael Herlihy.
Here.
Okay. So we have all members present and we have met quorum. I hereby declare that this meeting is called to order. A copy of the agenda and all related materials has been posted and can be found on the town of Monroe's website for public inspection. This meeting is being conducted remotely in compliance with the Section 1 of the Government Lamont's Executive Order number 7B, dated March the 14th of 2020, using GoToMeeting electronic conference technology. Using this technology, the public shall participate in real time in this meeting via computer, tablet, smartphone, or telephone using the access information set forth on the meeting agenda. Please be advised that each meeting has unique participation information, so be sure that you have access to the correct meeting. Notice is hereby given that only 250 participants may access this remote electronic public meeting at any one time. Access to this meeting using this technology is granted solely by the technology provider on a first access basis and is not controlled by the town of Monroe. While it is not anticipated that we will exceed this participant limit, if it should appear that we are approaching said limit and the public is denied access to this meeting, I as chair reserve the right to adjourn and continue the meeting at a later date using technology appropriate to ensure all members of the public may participate. Please take notice that of the following regarding this remote electronic public meeting. This meeting is being conducted in real time. This meeting is open to the general public. That any member of the public may listen or view this meeting anonymously. That this meeting is being recorded, and while we ask you that you mute your microphones unless recognized to speak, that anything you say, do, or is displayed on your screen may become part of the recording. The recording shall be posted to the town's website within 7 days, and this recording shall be made available to the public within a reasonable amount of time in town hall or upon written request. This meeting shall follow standard parliamentary procedure. However, I ask all participants to follow the special rules. In addition, please mute microphone to reduce background noise at any time that you are not speaking. Prior to speaking on occasion, please clearly identify yourself, and the use of the chat feature is strictly prohibited and will not be considered during this meeting. As set forth on the agenda, this meeting will feature public participation. I have not received any written comments from the public from either via email or posted to the agenda. And that is all she wrote. Okay, so first, thank you everybody for taking time out of your day to get this done. And at this time, I will go ahead and turn the meeting over to Nancy, who will start with agenda. And actually, we have done one. There is no public participation at this point in time. And so letter C will be actually approval of the minutes all the way back going to August the 11th of 2021. I have read them, and I will go ahead and motion to accept the minutes as written. And whenever anybody else is ready, they can second.
I'll second it. Nancy
Okay.
Brault.
Okay. And we're going to vote to accept the meeting minutes as stated. Mary,
Yes. Aye.
Chris Davis,
Aye.
and Michael Herlihy.
Aye.
Okay, vote carries unanimous. The minutes are approved for the previous meeting. And now Nancy, you can go ahead and get started on running down, starting with letter D and running right on down. Thank you.
All right, you're welcome. Okay, let's just start with D1, Environmental Health Activity Report. I also included the previous years because we'd missed a meeting, so I just wanted to make certain that you had the 2000-2001 report, as well as where we currently are, which is it's November this year. Couple things I want to point out. As you could expect, you know, we're not keeping up with our food service regulated inspections, and basically because this, you know, our staff is being pulled to respond to the COVID-19 with running clinics and such. So, and addressing complaints and concerns, and it's been keeping us extremely busy. So that's where the hole is that you will see in the budget. Not the budget, I'm sorry, the activity report. But does anyone have any specific questions?
Yeah, that was really the only question that I had. Being possibly even a little bit more specific as to some of the activities you guys have been doing, because obviously in years past, before, you know, COVID, you know, these inspections were done, you know, at very high numbers every single month to meet the total of, you know, roughly 250 or so per year. So there had to be at least roughly 20 or so per month.
Right.
And with the numbers being as low as they are, it was just a little bit concerning to me. So our sanitarian, what exactly is he doing kind of on a daily basis at this?
Oh, sure. So because we still actually have just hired a public health nurse, but she's only going to be with us a couple months. She's fresh out of school, and she's helping us with boosters and follow-up on homebound. So besides that, I've been taking over most of Heather's duties as the public health nurse. And by doing that, I haven't been able to do the environmental work at all. It's just a lot of contact tracing, daily calls and inquiries concerning outbreak cases in daycare and at our schools. And those they just take priority. Now, as well as we've been running one clinic a week, and to run one clinic, it takes almost a day to prepare to run that clinic. And I can't be there all day. Matt has to be there at least half, if not 3/4 of the day, while I'm following up on other work. So he's really out of commission 1.5 to 2 days a week just because of the COVID clinics. In addition, I have to attend 4 Department of Public Health meetings a month, 4 CDC meetings a month, and the list goes on. Just trying to juggle all of this is just very, very difficult. So I did meet with the first selectman about this, you know, some of our challenges. Some of our concerns as well is that we've been having a really hard time finding a part-time sanitarian to fill our part-time position. The guy that we had wound up leaving us, went on to a different full-time job. And as with the public health nurse, both of those positions are part-time, and very difficult to get part-time staff now. And we've been advertising since June or July to fill these positions. And so, we've been taking on the work that they would normally have done, and as you can see, we just can't get those mandated inspections done because of it. So I did meet with Ken, and his focus is get the mandated inspections done, but there are just other things that rise above the food inspections at the moment. And one is when I get a call from a daycare saying that they've got an outbreak and they've got 3 cases, and it's a complicated case, as you would suspect. I have to take that call. I have to do that contact tracing and try to stop the spread of the disease at that daycare. So those are the kinds of real world troubles that we are struggling with right now.
Great,
This
thank you.
is Mary.
Yeah.
This is Mary. I'm a little bit confused as to where the accountability is for the businesses, though, because I think that they can see and perceive loud and clear that they won't have any inspections done. So whether it be a salon or a restaurant, I think that there's probably perception that they're not worried that someone will come in. And here it is a time that there should be greater awareness. I'm hoping that one of the things that will come out of this pandemic is greater awareness of hygiene practices overall.
Mm-hmm.
And if they know nobody's coming in to check, there's even a bigger problem of nobody coming in to check and what could come out of that.
You're right. We've gotten out, it's not like we haven't at all been out there. We do expect to increase our numbers once we've passed this providing booster clinics. Yeah, I agree. And I'm not convinced that we're going to go back to normal anymore. And part of it is part-time staff. I don't think it's going to be very easy to get part-time staff anymore in public health.
It's not easy, but then what's the root cause of that? So is the root cause that there needs to be a change in what's expected in that position? So that
may be. That may be.
So if you've got a new grad nurse, an inexperienced nurse working in public health in a position where that person's the only nurse, who do they go to for guidance or mentorship?
That's exactly right. That is the problem. So
you hire someone who has no developed nursing judgment and they don't have anyone to go to, but hopefully they have somebody in Trumbull or in Stratford that they can
Absolutely. That is what we rely on as our partners to provide that support. And the new gal that's on now, she's an 8-hour employee. And, we've started her out with clinics. She's an EMT. And she's a volunteer at our clinic. Sorry about that, guys. You still there?
Yeah.
Hello? Okay.
I'm
Yeah.
still there.
Okay. I just dropped my phone there. So she is, she's also, we do have one other person who is working, funds are acquired from a FEMA grant, and she helps us just at the clinic. And so she's not a part-time employee for us per se. She's just here just to help at the clinics and to do homebound. So she is mentoring our new 8-hour staff member. So, we're not proceeding full tilt in training her because, as you know, Mary, these things take time. And for someone to even set up a clinic, there's a lot to know, more than just sticking a needle in somebody's arm. And so, we're playing it by ear, doing step by step. And if she stays with us longer, and I don't know if she will, she's young and she'd like to be an emergency room nurse. That's her goal. So, we are here now, and we're just proceeding slowly and deliberately in our training. But of course, that slow and deliberate means that more falls on me as the health director to follow up on other areas that our public health nurse would normally do. Yeah.
All right, this is this portion of the discussion. Just so you're aware, Mary, I don't know if you looked at the very latest email that Nancy just sent out right before the meeting, but we'll be talking later on during the budget portion of the meeting about additional staff members and so forth, okay?
Mhm.
Because I think that's a very important point you brought up with, business owners not having to really worry about the Board of Health walking in and quote unquote catching them doing the wrong thing. Obviously, we always expect our businesses in Monroe when we walk in to be catching them doing the right thing, but we know that's not always the case. So, yeah, I think it definitely needs to be addressed, and that's something that'll be part of the budget discussion a little bit later on in the meeting.
Okay, thank you.
So are there any other questions on the environmental health services report?
Not for me, Nancy.
Okay. All right. Then I guess we'll move on to the revenue report. Okay. And let me see here. So we were in good shape last year. We the income was greater than what we had anticipated in the budget. I'm trying to find my sheet here. And of course, it's under here. Okay. There it is, right over here. Okay. The Board of Finance actually revised our budget to $52,842 for revenue because of COVID and the concerns with COVID. But actually, we surpassed our own budget that our board prepared, and we had anticipated that the revenue would be $83,342. And what actually happened is we received over $87,432. So that was good news from last year. And this year, nothing really new to report, unless you have any specific questions. The numbers are there for you. We're at 24.4%.
What
Nothing stands out.
Please just refresh my memory. When do the Salon licenses get renewed?
Right now. They're right now, actually. We're in the process.
Okay, so that's like you said, we sending invoices now, and so we should receive that income in like January, February type thing?
Yep.
Okay.
Yep.
And then the food services was like March, April, if I remember correctly?
Yeah.
Okay. All right. All right, good. I'm good with all this.
Okay. So, but I was really pleasantly surprised for last fiscal year, that we did so well.
Yeah.
A lot of field work there. Okay, so that's it for the environmental health activity report and the revenue report. We can go down to grant status. The Preventive Health and Health Services Block Grant, we still have about $5,000 to spend in that grant. We came up with a couple of different ideas. We're still working it around on really what to spend that money on based on the grant. We were thinking we were going to do outreach, actually, do education at food operations, specifically operations in workplaces, though we don't have many of those. We were going to do outreach for educational initiatives for new mothers and breastfeeding their infants. And so we've done some of that stuff, but we still have like $5,000 to spend in that grant. And no decision has been made currently as to how we're going to spend that money. Emergency preparedness grant, things are continuing. We had a training couple weeks ago, or, and the types of trainings that we're having are, for hard to reach populations. How do you communicate with them to promote public health? It's in a generalized way. That's what that's about. But other than that, there's not much to report on the Emergency Preparedness Grant. The Health Enhancement Community Grant. I'm sorry.
Quick question, Nancy. Hold
Yeah,
on.
I've switched actually. Yeah.
The preparedness grant stopped in June of 21. So.
Oh, it has been extended, and I did not fill that in. I'm sorry.
Okay.
Yeah, we're still getting grants from them, and I'm trying to refresh my memory here. I apologize on that first, the Preventive Health Services Grant. That is a blood pressure grant, and I need to write it on here, blood pressure grant. And we haven't done anything on that. Let me back up. We don't have the staff member to do it. Number 2 is the Emergency Preparedness Grant, and I will have to update the dates on there. And funding is the same. So it's the Health Enhancement Community Grant that is, we have the $5,000 remaining. I apologize.
Okay, but that was also supposed to be used by September of 21.
Right, and it wasn't used.
Okay, so what happens with that money then?
Well, we still have it. We still have it. The town has the money. We just have to essentially spend it. That's a grant that we've been working with Stratford and Trumbull on, and the problem is we were unable to use the money because the money was earmarked for would require us, an inspector, to go into a workplace to really meet with people one-on-one. And because of COVID, that's something that we weren't doing. So that opportunity, that door closed. And so then we were trying to think about how are we going to spend this money. And so we actually did at the farmer's market, we wound up setting up a display booth. We gave out little gifts like bibs and things like that, a basket, to try to, to inspire, moms to breastfeed their children, that type of thing. It was very good, but there were not a lot of moms at the market. So, but it's what do you do? So we're still figuring out how we're going to spend that money. It would be great if I had a public nurse to discuss that with, but so then down to the ELC grant. A lot of this funding was supposed to support a public health nurse, but it would be temporary and part-time. And though some of that money has been spent, a lot has not. So it's a very challenging situation on how to spend the money because you need the staff in order to spend the money. I added on here the ELC2 funding grant. That's brand new, and that starts in March for $71,557. And so I called up health directors, specifically Stratford and Trumbull, because we're all having a hard time getting public health nursing staff. And I'm suggesting that, and we could probably, go through MetroCog or something like that, but to hire a nurse, really with all of us pooling our resources. And then that nurse could manage like a bank of volunteers, maybe MRC volunteers that could do contact tracing. So that, we're in discussion now regarding that. But for each of us to hire a part-time nurse just does not make sense.
Can they? Can we do something? Does it have to be an RN, or could it be like an LPN?
It's a maybe. It's a maybe, but still the LPN, it'd have to be a part-time employee for,
I understand that. I know I know registered nurses
Public
right now are huge.
RNs because of the education base.
Sorry, Mary, I lost you.
I believe public health nurses have to be RNs.
Okay. My thought was that, because RNs are just in such huge demand right now, if we could visit one of the several LPN program schools around to see if there would be a nurse that would be, interested in public health, and then in exploring that with the partners to, share expenses in some how, shape, or form type thing. Hiring somebody as a full-time employee where, us or them could bear responsibility for it, and then us or them reimbursing the other for certain amount of hours or whatever the case may be.
Right.
I'm sure that would have to go through town council to
Oh, yes. Yep.
approved. But obviously something needs to be figured out. I mean, if a public nurse has to be an RN, then so be it. In which case, then, the same options are there, as far as I can tell.
Right.
But I know, Griffin right now is in the process of hiring. I can't tell you how many LPNs, which is almost unprecedented in a hospital setting, because
Right.
we just have no staff and we can't get staff. Nobody wants to work. There's just nobody out there available coming in for the job. And it seems like counterparts at the big institutions of Yale and so forth have been saying very similar things, because there's a lot of the, talk amongst, OR managers and other, VPs and so forth, that Yale's offering all kinds of money and they can't get people either. So
Healthcare,
it's just us.
3,000.
What's that, Mary?
Anybody who can, Hartford Healthcare right now has a $3,000 sign-on for any RN. And anybody who can travel right now, even if they're locally traveling, people are leaving their jobs to do that because it pays more.
Yeah.
Yeah. We're thinking that at least Stratford and Trumbull health directors, if we wanted to get somebody with a really good skill set, could be somebody with epidemiology background, and pay that person what they're worth for this position. It goes through July 2023, and it's entirely possible that in the future we could still pool resources and pay this person so that she's on hard money. But again, there's a lot to be discussed there. I even with the gal that's come up with us, she's right out of nursing school. And like Mary says, it takes time to train somebody and to do it right. Even as a vaccine clinic, there's a lot of paperwork that goes with that to ensure that your annual forms and inspection details and everything are forwarded up to the immunization program. And that's a lot to know. And matter of fact, I don't know that piece, and I have to learn it in quick order because it's come due, because that's something that our public health nurse always took care of. Yeah. So that's, any other thoughts? Or
I can't think of anything else besides, again, going to an actual nursing school and trying to approach right out of school, like we already have this person,
right.
again, pooling resources with another municipality to see if we can't lock somebody in. I mean, at this point, we can tell them, we can guarantee you, obviously not use the word guarantee, but we can, we have funding for the next several years for this, and there's an extremely high likelihood that, it will be a long-term position if that's what you want, type thing.
Right.
I don't My personal opinion with experience, though, is that you're not going to solve the problem very quickly that way, because if you go to a school to recruit, they not only have to complete school, but then they have to also pass their exam and become licensed. So
Well, there's a lot of
you would
there's a
be
lot of
waiting,
schools that end in December.
and
Okay.
they still have to finish, right, and they still have to pass their licensure. So you can advertise, and people that are looking for jobs are going to see a job. But if you want somebody who has absolutely no experience, you can recruit directly through schools. If you're advertising the job and it's only on the Monroe website, which I'll tell you, when there was an opening that I applied for, I had to find it for myself. Like I had to be looking for it to find it. It wasn't finding me. And so the job posted on you have to be looking for a public health nurse position in the town of Monroe to find an opening in the town of Monroe for a public health nurse. So unless it's being posted somewhere else and put out there so that it's going to be seen, it's not going to be seen.
Yeah.
And unless there's some flexibility to the hours, both ways, the person being hired has to be flexible to what's needed, but the position, if it's doing things like contact tracing, that can be done off hours if the person does have another job and is looking to extend themselves to the position.
Right.
So it has to be able to be flexible both ways. But the only way to know this position's available is to look for the position, unless the position's being posted differently now.
Now, yeah, and I think that. I don't know if that's part of it, but a lot of jobs these days, they are posted online, and I don't recall the service that you if you're looking for a job. Craig told me, our human resources director, that it was posted online for a month. And we did get a lot of applicants, though. We really did. But the applicants were licensed out of state, or they wanted a full-time position, or they really didn't have public health nursing experience at all. And what's funny is now it's like, well, what kind of experience do you have? I mean, the climate has completely changed within a year, you know?
So I have a question, and I'm not the only one that doesn't understand this. We can certainly skip it. But when FEMA money came into the town to cover things that are pandemic related, such as setting up for clinics and getting, doing whatever had to be done for contact tracing, for whatever the FEMA money was that came in and was however it was distributed.
Mm-hmm.
Did any of that go toward covering the expenses of the Board of Health or of the health department?
Well, what happened is that we wound up hiring per diem a nurse and an emergency preparedness coordinator. The emergency
people were hired per diem, but how many hours, how much of that money was paid to those people?
Well, I can't tell you that because I'm not sure. I'm not sure of how much was paid to them. That I can't tell you. But what's recently happened is with the FEMA grant, I basically got word last week from our assistant finance director that we have to look back at that grant to see if the money from the FEMA grant that they were going to write in, as expenses, that if we can take that out of the ELC grant. And so I've got to go back and ask the state health department, can we charge those costs under the ELC grant? So
what I'm thinking is to go outside of the box and say, if FEMA funding is available and that funding would appropriately be used, and I don't know because we haven't met as a Board of Health very much during this pandemic. So other than what I can read in the newspaper or on websites, I'm not informed through the Board of Health as to what those funds are designated for when they come from FEMA to the town. But the town's Department of Health, the salaries for Nancy, Barbara, Matt, the public health nurse that's only an 8-hour position, are already covered by the town budget. So
that's
whatever
correct.
money is coming in from FEMA, but clinics are covered by volunteers. So the money coming in from FEMA should be able to cover personnel that's needed to cover the extra hours, it would seem to me. So if we need more public health nurse hours and we're only getting applicants for, if they want more hours than what per diem will give them, can the FEMA money be used? If Nancy's having to do all the work that used to be done by the public health nurse, could it instead be that someone's hired and the expenses covered more with FEMA money?
Right. That I'll have to ask finance. I don't know because I'm not involved with managing the FEMA grant at all. I know that Ken has requested funding for these other two positions I was talking about. And I don't know if it was written into the grant. I really don't know how that works. Does he just quarterly, do you just send out a report to FEMA and say, oh, by the way, we hired these two people because we don't have the money and therefore they pay? That I'm uncertain of. I don't manage that end of the operation, but I do know that I've been asked to look at the hours for those two positions to see if we can take that money out of the ELC grant that we have, because FEMA will not reimburse the town that money unless we've used our grant money that we have in hand first. The challenge for us is the money that we have in hand through the ELC funding. That money, the grant was written such that it would fund other types of public health COVID-19 issues. So it's kind of tricky. We're going to have to, it's a look back and try to recreate this. I have to talk to the state health department. It's going to be very complex. Let's put it that way. But I can look into that and get more information regarding the FEMA grant. And I think that's a good idea.
I mean, it seems that if the money is there and there are people that would be willing to do the job if the job was more, and that would free up the time of our already salaried sanitarian and director of the health department to do the jobs that are under the usual job descriptions for those.
Mm-hmm, mm-hmm.
It would let there be normalcy in the normal budget and the FEMA budget covering some of what goes outside of it.
That's one thing that we can look at. Yep. Good idea.
I mean, we're half into this pandemic now. And certainly we know that there's ebb and flow. We know that there's not a normal, never mind a new normal. There's just no normal right now.
Mm-hmm.
But, I go to the hairdresser and my hairdresser has you wait in the car until the client before you walks out the door and she sprays down your chair. You go to a nail salon and I had to ask them, and hey, I'm still choosing to go to the nail salon, so I'll take that on my back. But I had to ask them to clean where I was going to put my hands because they didn't between the person before me and me. Mm-hmm. And when the Department of Labor shut down one salon, there were twice as many people in another because it was still open. And the Department of Health license is hanging on the wall because they're fully licensed by the Department of Health, but now they've got people crowded in twice as close as usual, even though we're in a pandemic. So, people know that the Department of Health isn't going to come in and check. They know that.
Well, that whole, that 6 foot separating distance, mask wearing, all those things change. And basically we're following the lead of the governor. And a lot of towns are not, they're requiring mask wearing right now in public buildings. So, really.
Well, the more densely populated are going by their numbers, I believe. If their numbers are higher and they're a higher density population with a higher positivity rate.
Right.
And they drop it when the positivity rate goes down.
Right.
But again, it's just not an apples to apples comparison because positivity rate all depends on how many people are being tested. And if more people are tested, the positivity rate is lower. And if fewer people are tested, if you're only tested because you have symptoms, you're going to have a higher positivity rate.
That's right. Right. Oh, so the other thing I just want to mention, besides the position of trying to find a part-time nurse, the other piece is to, if you were to get money from FEMA to hire a full-time nurse, they're hard to get anyway. Um, um, they're just want to put it out there, very difficult, because that's all. This is all soft money. It's not like working for a hospital. You know, I don't know if you agree with that, Chris.
Well, yeah, I mean, I get it. It at this point, looking at, just looking ahead, it's a matter of, we have funding through 22 or 23, whatever it is. But after that, it's like, who knows?
Yeah, yeah.
I mean, and nobody knows, because
No.
nobody knows what the hell this damn pandemic's going to do.
We don't. We had a meeting today with all the directors of health and the commissioner of public health, and that came up as an issue, trying to find staff during the pandemic. There are other things that are on the horizon that I think we have to plan for as part of increased staffing, and that is it's expected that in this coming year that we will be finally adopting the FDA code. And these inspections are comprehensive. They are a different type of an inspection, which takes more time to do. I contacted the state health department, and I'm trying to get data on like how much more time. Is that 25%? Is it 50%? Because they do a lot of risk-based inspections. Not I'm going in to look at the floors, walls, and ceilings, but really getting into the nuts and bolts on food handling, hand washing, temperatures, cooling, all those other things that are of more concern with foodborne outbreaks than the latter. So yeah.
Well, it certainly sounds like we need to, continue this discussion, and obviously, we need to find out some of these things about what monies are actually available to us through this FEMA fund and any other grants that may be available, with designated funds coming from the state and the feds and whatnot. And obviously, you need to speak to the finance people to see what their take is as far as how we can spend this money.
Right.
So, I mean, at this point, we can continue talking about it, but we're not going to really get anywhere until you can kind of do what you have to do on your end, Nancy, and or speak to, speak to finance. And I think probably the place to start is with Ken.
Right.
Look, this is what I want to do. This is what I feel we need to do. You have my back, or what can we do? What direction can we go to secure more funding for additional people? Because right now, this, basically, things are just kind of a running amok in essence. Just as Mary has said, they know nobody's coming.
Right.
Because you guys are so busy doing other stuff.
That's it. It's like being in a firestorm, and it's like, I'm constantly juggling, one issue after another, just trying to get a report done. It feels like there are just so many things that are fractured. And then we have a new employee that comes on, and, she doesn't have all the passwords. These are just simple things, but she doesn't have the password to the computer, to the intranet, the email, all these things. And things have changed in human resources where that is kind of pushed on to department heads. I'm like, wait a second, I don't know how to set these people up with all this stuff. And it's like, I don't even have time to do it. And, so there's a lot of pressures, I think, from everybody because of COVID. I think that is really changed the world for municipalities for sure.
Agreed. So let's
Yep.
let's
all right.
let's just put put some notes down, so we can further the discussion the next meeting.
Okay.
And hopefully you can get some kind of answers,
Okay.
for us, and then we can start to hopefully formulate some type of plan of attack to start diving into these issues and see what we can get fixed.
Okay.
Okay.
Thank you.
Okay, so we pretty much covered all of the grant stuff. So now we're going to move into our unfinished business, which, just glancing at the Board of Health agenda from August, I know we kind of abbreviated a lot of stuff. But just a couple of quick questions that I had was, number one, what was this, the Rotary Club presentation? Because I don't remember what that was at all.
Okay. So
And
Ken,
the
yeah,
other question I had
yep.
was, how are we doing on school age vaccinations in Monroe?
Okay. The let's see. So let's start with the school age vaccinations. We had a clinic yesterday for a second dose for 5 to 11. Had about 100 kids, and we provided their first vaccine about 4 weeks ago. I don't have I don't have the numbers of the percentages that are vaccinated right now. I don't have it with me. I'd have to get back to you with that.
Okay. So let's we can table that. I just think everybody would kind of like to know some of the numbers.
Okay.
I mean, I don't know if you're going to get those numbers, because if my kids are both older, but if they were younger, I'm going to my doctor. I'm probably not going to walk-in clinic.
Yeah, but the numbers are still not necessarily our numbers that we as a town have actually administered, but more of, percentage wise. Okay, if we have, just to pick a number, we have 1,000 children in the school system, we have 250 of them are fully vaccinated. Well, that's 25% of the total population, and that's kind of what I think I would like to know. That way we just have an idea of what the pulse is of the community, as to what they think if they think that is something that's important. And if they do, then maybe we should continue to push it. But if they don't, then why would we waste resources trying to push something on somebody who is not interested in it at all?
Right.
Well, another thing is, there is the VAMS system. So any vaccines that are given are recorded. So that would be accessible through people who have the right access, which would be school nurses and public health officials. But because it's not a required vaccine for school attendance, the school nurses don't have to keep track of if kids have received it or not. So if it's required to attend school, the school nurses have to have record of it. But people don't have to send record to school of COVID vaccination because it's not required. So what is recorded at school wouldn't necessarily be 100% of what's been received by students. Does that make sense?
Yeah, no, I was looking for more of just like what VAMS would be saying. So like state numbers that we would be getting, like we get numbers for what the general population is for Monroe. Why couldn't we have, what the numbers are for school age children?
I can pull up information for our clinics, but I'm not able to pull up information for the town of Monroe.
Okay.
I'd have to take a peek to see if there's something up on the state website for vaccine, and if they break it out by town. I don't know if they do, but I'll get that information for you.
It's not that important. It just seemed to me like it would be a nice thing to know, just based upon, just the general public, because there's so many people that have such strong feelings in both directions about the vaccines. And if we have some, but not a lot, Is it an
All right.
education thing or exactly what? That's all. So we can continue on past that.
Yeah,
Yes, it's available at Connecticut Data COVID-19 Vaccinations by Town and Age Group. Health
Oh, okay.
So we can
But
all look at that later.
also,
But there's a table of towns, numbers, ages. Okay.
All right, go ahead,
Oh.
Mike.
sorry
What
to
were you
follow
saying,
up on Chris's point, but I mean, you're saying you're stretched thin. So, I mean, are these worth it for the town to hold these where it's taking up your time and everybody else's time where you can't even get inspections done?
Yeah, you're right. We when we were planning on having the first child clinic, we were ready to go for 500 to 600 kids. But we only had 100 parents or 100 kids that the schools were able to find for us. What happened is the Board of Ed, they sent out an email asking, parents, do you want to have your child receive the vaccine from the health department? And we thought we were going to get 500 or 600 kids. But what happened is we only got about 100, 120, something like that. So we're thinking that a lot of families took kids in other locations because we were doing seniors. We were held back a week, right when it was approved for kids to receive the vaccine, we had already scheduled seniors. So we had to make it through that group first. So I'm thinking that a lot of parents that wanted their children to have the vaccine right away, that they jumped the gun and before we could get there, so to speak.
Thanks, Mike. That was a good point because that's kind of what I was driving at. Is it worth us as a town pushing to do this kind of thing when our resources are just stretched so thin as it is? So okay,
Right.
Nancy, keep
Yeah,
moving.
no, I think Mike's right, and Matt, we did not plan another clinic because of that very reason, because we couldn't fill up that first clinic. So yeah. Since we're speaking about clinics, let me just mention one other thing. So we finished our last large clinic yesterday, and so going forward, we are going to be scheduling office hours at the town hall nurse's office, and we're going to be providing booster shots for those that want to sign up to get a vaccine, and we're going to advertise through the town website rather than just putting it up on VAMS, because you'll have a lot of people from the outside coming into the town competing with those in town that are trying to get the vaccine. So that'll be happening. The first clinic that we're planning on is on the 15th, and then we'll probably wait until after the holiday and begin anew on Wednesdays. So.
Okay, great.
So quick answer is 30% of our 5 to 11-year-olds have initiated the vaccine.
Oh, good.
Okay. All right. So tell me a little bit about the Rotary Club stuff from last time, Nancy.
Okay, that was just basically, Ken wanted to do some education of his Rotary members, and he asked our staff to do a presentation. So Matt provided a presentation to the Rotary concerning septic systems and B100 plan reviews, that type of thing. We were there for a couple hours. That's all that was.
Okay. Okay. All right. So we're going to go back to the budget in just a moment. I just want to the dates, the board meeting dates for next year. Is it safe to assume, Nancy, you have checked all these dates to make sure there's no conflicts with any kind of things that are going on through town hall? Or it didn't look like there was any kind of
right, a cursory,
like
yeah. A cursory review, I didn't see anything.
Okay. All right. So we're going to go ahead and bring that to a vote on the board meeting date as published. I will motion to accept them.
I will second it.
Okay. Mike Hurley, he has seconded. Nancy?
Yeah, yes, I
Okay.
agree. Yep.
Chris Davis?
Aye.
Okay. And Mary Porter?
Aye.
Excellent. The vote carries unanimous. The board meeting dates are scheduled as such and will be filed with the town's clerk. So the last order of business is the big one, which is the budget. Unfortunately, we have to make sure we get all the way through this this evening because we have to present this all to. This all has to be given to Ken by January, like the 2nd or 3rd type thing. So the questions that I have, Nancy,
Mm-hmm.
are this. I'm looking at. I'm going to start with. Oops. The actual health department budget. It's the one that goes sideways. It says department : health department, and it has like the salary details and then
Yeah.
health department and such. Well, it like the 22-23 like doesn't have like a revenue on the very bottom in the middle. There's no revenue estimates there.
Look on the third. Look on the third page. And this report was given to me from finance, and we have to fill in the blank.
Okay.
And and if you look on page 3, it says there's a colored line. It's a 22-23 department, and that's where we fill in what we think we're going to get under those each category.
Okay.
And so, yep. And so if you would take a look at the budget comparison report, which has hold on a second. Sorry, looking at the wrong one here. Expense. Yes, that's the correct report. Okay, it'll take me a minute to figure it out here.
Okay, so you want to look at the budget comparison report, which has
Yes.
the 15, the 17, 18, 19, 20, all the different years on it in the actual.
Yep, that's it.
Okay.
So all we really need to do is agree on what those numbers are going to be. And then essentially those numbers is what fits into the health department budget for revenue.
Okay. All right. So the only questions I would think we should really be pondering at this point are, do we have the same amount of licensed food facilities in town, or have we dropped?
Well, things change a little bit, and you'll see on that proposed report that has the many columns where Barbara has already filled in proposed for food service licenses. She has it on there as 27,610.
Hold on, I can't find that.
It is the Monroe Health Department budget comparison report. If you go all the way to the right, it says comments. The next column to the left says proposed 22-23. Yep.
Okay. Oh, okay. Yeah. All right. So that 27,610, that's based on number of current licensed facilities.
Yep.
Okay.
Yep. And so if you go down the line, it's the same thing with daycare, salon licenses. So those are hardest numbers that we could come up with for those that are we're licensing now.
Okay.
It's the other numbers that are not filled in there that we need to think about. And I think last year we just said, well, let's just use the numbers from the year before.
Well, and I think that's, at least in my opinion at this point, just based upon, again, uncertainty of what the next year is going to bring. In 2020 to 2021, the actual from previous fiscal year, we really held our own going down the numbers. If you just kind of look across for each one, I would almost be inclined to bring every number just based on facilities and approximately what we have, possibly even lowering it by, let's say, 5% or some other number that we can all agree upon. Just based upon, there's going to be more turnover. There's going to be potentially less restaurant, less this, less that kind of thing. I'm not sure what everybody else feels. So, please, everybody feel free to kind of chime in here. I know the protocol is supposed to be identify yourself, but I think we all know each other's voices pretty well at this point. So, please, anybody, any other ideas?
Chris Davis is here. I guess this is a question for Nancy, because you are the employee of the town. What does Ken, and you know Ken the best, what does Ken like better? Does he like to see a number that is exceeded, or is he okay with us to try to, is he okay with a number that is not met?
I think that how he sees this is that you make the best guess, and you start with the guess by saying, I know I'm going to get, like for routine food service licenses. Yeah, you might have one restaurant closed, you might have another open, but that's a pretty hard number. You know what I'm saying? So we always stick with those numbers of regulated facilities, because the opening and closing, it seems we've never had mass closures. You know what I'm saying? We just haven't.
Right. Yep.
So in that regard, we just put down the numbers that we had, we expect from our licensed facilities. So that's a no-brainer. Now, food service re-inspections, we're trying to get the regular inspections done. So I probably wouldn't go up higher at all on food service re-inspections. I'm sorry.
Right.
Because there's that re-inspection fee. I would probably stay the same at 500.
Okay.
Do I remember correctly from the past that when it's almost time for inspection, the regulations are sent to the businesses so that they can go down their checklist to make sure things are in order prior to the inspector coming in?
Well, a part of state law, is if you do a routine inspection in a restaurant, and there are different intervals. Most of ours, they are inspected 2 to 3 times a year. And when you go in for an inspection, those intervals are outlined in the public health code and in the FDA code when you go back. So what happens is everybody knows you're coming 2 or 3 times a year, and they know about when you show up. Unless you get a complaint, then they have no idea you're showing up. But so other than that, we show up within the month that they think that we're going to be there. And if we do an inspection and there are debited items, or if they failed an inspection, there's the requirement that we literally write it on the form when we're going to be back, because that inspection form is considered an order of the health department. And so we need to let them know when it needs to be done by, and that's when we do our inspection. And sometimes it's not exactly the same day. It might be a few days later. That's just because of the ebb and flow of work. But
so the overarching goal or purpose or mission of the Board of Health of the town is to keep services to the town healthy, correct? So
yeah,
it might seem a little silly, but if a reminder was given to all businesses saying that these are the expectations of your business and sort of implying that an inspection is going to happen soon, even if we don't have the manpower to do it. But if right now we know that the businesses know nobody's walking through their door and doing a surprise visit, and they can be lax, if they're given that little reminder that makes them think, oh, maybe they're going to be coming around, maybe in the best interest of the town, businesses would kind of make sure things were good in case an inspector did come through their door. And maybe if the time does become available for inspections here and there, where they're done, they would be in good standing.
That has
And in the
not.
best interest of all of us, things would be in a healthier state.
Yeah, it has not been my experience at all that writing a letter would be helpful. It is literally going out there, debiting those items because they know that's public record and that it can get in the newspaper. Huh?
Then we got to get out there.
We do. I absolutely agree. We have to get out there and do those inspections. And it's strictly a staffing issue right now.
Well, because Mary, think about this. The Department of Health doesn't tell you that they're coming to the hospital. I mean, we all kind of have an idea because they've been at Yale or they've been here or they've been there. But we all know what we have to do. They know what they have to do.
They do.
So,
yeah.
While, yes, I kind of agree conceptually with what you're saying. You're talking about a bunch of manpower, a whole bunch of money in postage to send out to all these different restaurants and facilities. I just don't see it being feasible, at least at this point in time.
Well, is it necessary? Like, obviously, best practice would be to go out to each company, each restaurant when they're ready, or when they're up for inspection, and to do a thorough inspection. But I'm sure that thorough inspection includes a lot of things that are A, typically okay, and B, are not really that critical to the safety of Monroe, but take a lot of time. Are there like maybe one or two things that you can do and do quickly to many different restaurants now because of this situation that we're faced with? Or are you mandated that you have to go, when you go to an inspection, you have to do everything from A to Z?
Well, let me put it this way. There are health departments that are doing abbreviated inspections, but there is no support for it in law. When I sign off on that inspection and I'm only looking at temperatures or, handling of food, hand washing, I'm signing off on a form that says I've seen everything on that form. And you grade somebody. I'm going to give, let's say on those few things, they're 100, but I can't give them 100 because I haven't looked at all the other things. So it's very tricky. And some health departments, and, I haven't done the research to find out, maybe they just feel that, well, we're going to wing it anyway. And just do an abbreviated inspection. Don't know, but there isn't law for that.
So someplace was grossly negligent. How much of that, or let me put it a different way. If the town has renewed a license, allows a business to stay running with our stamp of approval, or with the Department of Health stamp of approval, and something happens that is detrimental, how much responsibility does the town have for that?
I would say that the responsibility falls on the restaurant owner. They're required to have a qualified food operator that is trained and knows how to handle food. And that if there's a foodborne outbreak, that if there's culpability, I doubt very much it would rest with the health department.
Okay.
I'm not saying, I guess I'm not. It's important for us to get out there. Don't get me wrong. But I don't think all of our restaurants are failing to keep sanitary levels of sanitation because of COVID. I just don't. We
No,
actually have
I'm
very,
not.
we have very
COVID,
good restaurant in town.
because they know nobody can come in and check.
Huh?
I will no longer say because of COVID about a lot of things, because I think that blaming everything on COVID isn't something we can do. I think we need to adapt what we do to the fact that we have to do things differently with awareness of COVID. But if somebody walked into a restaurant, saw something that they disagreed with, and said, "When's the last time the Department of Health was in here?" What's the answer going to be?
If anybody calls the health department because they're concerned that a restaurant is dirty, I want them to call us and we'll go out. That's absolutely, that will happen. But Mary, I haven't gotten complaints from patrons of restaurants. We haven't had any foodborne outbreaks. I just don't. Yeah, I just don't see, I haven't gotten any reports of food workers that have been ill and that have been working. So I'm not saying it can't happen, but I just don't think because of COVID, everything's gone by the boards. I just think that in general, we've got to really, we've got operators that care about their businesses. And just because a disease kind of takes the wind out of everybody, I don't think it necessarily makes them become unsanitary restaurants.
I'm not just talking about the restaurants. I'm talking about all the businesses that you normally would be checking on or whatever. The salons that the Department of Health has to think about.
You're right. No, you're right. That's why I'm hopeful that we can get some help because, when you're in a crunch where you don't have, I had, for instance, I had an issue happen where we had sewage flowing down the road. And, Ken said, well, Nancy, I need you to write this, get some information so he could put together some outreach that he was doing on Code Red. He needed some additional information. I'm like, I can't, Ken. I've got sewage running down the road. And that's the first thing I have to do.
Right.
So, and it's the same thing with, today I had 3 different daycares calling me, and that's the first thing I have to do right now. And I recognize that there are other things that must be done. But, I just feel that there's higher risk in a daycare where you have a child that's sick and they don't know what to do than one of our restaurants at the moment. Hard to make those choices, it's on what to do first. And hopefully this new normal that we're in, that we'll be able to adapt to it, like you said.
Okay.
But there's a lot of communication that's got to happen, and Ken wants a report from me this month, and so I'm in the process of putting that together. He wants to see what additional work we do in each of our positions, so that he can kind of vet out okay, Nancy, previously you could do, let's say, 10 restaurants a month, and that 10 restaurants take about 2.5 hours each. So where did that time go? Well, I've got 10 extra meetings I have to go to a month. I have, I can just go down the list. There's more work that needs to be done that just can't get done. We were talking about a strategic plan. We are talking about, public health outreach with speakers, putting together a community health improvement plan, community health assessment with others. These are big things on the horizon. And, we're kind of caught back here trying to get sanitarian help to get us to get those food service and salon inspections done, So. So is that it?
Okay, so we're going to go right back to hard numbers here. We're going to go ahead and say that the couple of major things. So we're basing our proposed income off of actual licensed facilities for food as well as for salons. So we're going to keep that that's our status quo based on current licensing.
As well as daycares that we're projecting,
That's fine.
public pool licensing.
Right. Yeah. The pools have they've been pretty steady.
Yep.
The daycare is the same thing. As far as like the B100s and soil testing and so forth, I would be in favor of keeping whatever numbers we budgeted or attained in 2021 in 2021 previous fiscal year, carrying those to budgetary numbers for the next year.
Okay.
Because just looking back on most of this stuff, we've been again fairly consistent year after year in most of these numbers. There's been a little bit of a fluctuation here and there, but I would say they've been fairly consistent, and I don't believe a lot of the any construction and renovations and so forth are going to be slowing down anytime soon. So I don't believe that a lot of these applications and reviews are going to be going away in any kind of large shape or form, in my opinion.
Right.
So I would say we should be able to carry those numbers straight across to our proposed budget.
Do you want me to use the numbers from 2021? I mean, that's because we're only, I'm only showing you part of the 7/21 to 11/21 actual to date. That's all that we can go off from.
Right.
Okay. So we can just put those numbers in. I don't really feel that there's going to be a lot of change.
No, I don't think so either. Does anybody else think there's going to be any kind of huge change or swing in the things that we do, such as the, again, construction stuff, the B100 testing, soil testing, septic plan reviews, permit to construct, those types of things. Obviously the food inspections and that's straight up. The re-inspections are probably going to be a little bit less unless there's a way that we can attain an additional sanitarian.
Right.
But like the plan reviews and, I would say we would, err on the side of caution on those two numbers. But the rest of the stuff I would say is going to be pretty much straightforward. Any thoughts, Mary, Chris, Mike?
No, I think they can all get right across.
Yeah, me too.
Okay.
Yeah, I guess one concern would be is like, did it look pretty similar with like the new building and all the perk testing from the COVID time, the COVID year, as previous years?
Well,
Actually, we did have a lot of B100s that came in. Yes. We did not anticipate that we would do as well as we did.
I would almost say, Nancy, we should be using the numbers from 19 to 20.
I agree, Chris. That's exactly what I was thinking.
Yeah, that's a really good point, Mike. Although I don't think, I kind of don't think construction's really going to slow down any, because I don't see the housing market changing a whole lot of, anytime soon. But again, we're obviously looking from right now a year and a half into the future. So obviously lots of things could happen, but we're not talking about tremendous differences in most of the numbers that are on there from fiscal year 19 to fiscal year 20.
Okay. So you guys, you're thinking of that to go with fiscal year 19, 20?
Yes. Take the numbers from there for all of our construction related items,
Yeah.
and flip them right into the proposed budget for next
Wait a
year.
minute. The 19 to 20 actual?
Yes,
What month of 19 was it? To what month of 20?
fiscal year. So it's going to be July 1
Yeah.
to June 30 of the following year.
Okay, yeah. So only the last 3 months of it were pandemic months. Yeah. Okay.
Right. And with 2020 to 2021, that was obviously full blown pandemic stuff. So a lot of the construction stuff
Yeah.
went up and that sort of thing. So I think if we look at a little bit more of a normal,
So it's a more realistic year.
yes, that's
Okay.
that.
Yeah, I
that-
agree then.
Yeah, I think
And it
that's
is a
good idea.
higher number. It makes sense that it would be the higher number, the 89 total number, 89,000.
Yeah. So at this point, Nancy,
Good
go
catch,
ahead.
Mike.
I'm sorry.
I said, good catch, Mike.
So we'll, with the obvious exceptions of the licensing, which we've already discussed, bring everything over from fiscal year 2019-2020 into our proposed budget for next year.
Just want to say that will be the highest budget income. I mean, I'm going back to 16, 17 because it went 82,000, 83, 86,
Right.
89.
Mm-hmm.
That's
And
what
I
we're
think,
saying. Yeah.
I don't know. Yeah, that's asking a lot. You really think that
Well, he's only asking to raise the other things. He not not the stuff that you guys have already come up with for licenses and stuff like that. Just the building stuff, right, Chris?
Yeah, because
So don't just take the total number, but it's just those other ones. I don't know.
that's correct.
so let's go down the list. Let me just like food service plan reviews. Keep the 2,820, or do you want to go to,
No.
2,460?
No, we have to go lower on that because we know we're not going to get to them. Again, unless there's some way we get another sanitarian in here.
Oh, no, I'm talking about the plan reviews. I'm sorry, item 3.
Okay.
And that doesn't matter. This is what you're thinking about are the re-inspections?
Yes.
Okay, that's correct. I thought I'd just put down 500 there.
Okay, so we'll put
Yeah.
the 500 into line 2.
Okay.
The plan reviews. That the refresh my memory. The plan review is just kind of like a remediation plan to cure whatever problems that are
Oh,
occurring.
no, that's a new restaurant coming in or one that's flipping over in a new ownership, and they're giving us plan reviews, food service plan reviews.
Okay.
So I'm just thinking we can put down 2,460.
Why not go to around 2,500?
Yeah, because I mean, in 18 we only had 1,600 of them, $1,600, and
Yeah.
We had a huge number in the next year.
right.
Did we have a bunch of new shopping centers open or something? What the heck happened that year?
Well, lots of times you have just businesses closing and others opening, and every one of them requires a plan review.
Yeah.
I would tend to err on the side of caution on that one. I would lower it. I would use the 2020-21.
So do the 2,460.
2460.
Okay. And temporary events. As you can see, there's a lot that has fallen off there, and that's because
Yeah.
of COVID. Yeah.
Well, I mean, you know.
Go halfway between the two.
Well, because previous years we were, significantly higher.
Exactly.
I'm thinking that I'm obviously optimistic that things will, improve. So do we want to leave it at what actually it was, the 1,400 number? Or do we want to go a little higher than that?
I think we can go with the 2920 because look at the 2 years before that.
Right. All right, put down 2920 there. Bring that over.
Okay.
All the late fees, that's fine. I think the wells, I think are still gonna be cooking with gas big time. Soil testing, that kind of goes right along with wells.
Well, no, it doesn't.
100s and soil testing, B100 site visits.
See, and a lot of work that's been done too is because when people are home all the time because of COVID, what else are they going to do? Fix their house.
Yep.
So that's
Well,
you're
and
gonna,
septic, when people are home all day and working from home and the kids were home all day, people's septic systems were getting a lot more use than they normally do. And their
That's
wells were
right.
getting a lot more pull than they normally did. So people were probably needing a lot more than they normally do.
Yeah. So
When the
that's why you're
family's
going to,
out all day versus home all day.
yeah, yeah.
All right, bring over the 2850. I would bring over the 15,000 for line 14.
15,235, right?
Yeah.
Okay.
Um,
And the B100As, those are, I'm adding a shed, I'm putting a garage on, I'm adding a bedroom. All of those are those from people that are home that are looking for, to make their home a better place. That's why you see that number jumping like that.
yep. I mean, that's been a steady increase since we've been tracking this.
Yep. Yep.
I'm
You want to keep it at the 9180?
sure. I mean, it's only that's only $400 difference than the previous year anyway, so that's not a big
Right.
deal.
And site visits, we very hardly do any on those.
That's fine. Keep that at 0.
Yep.
Planned septic reviews. I think we need
We're
to
high
scale
to
back.
date this year already.
Yeah, we're halfway there.
Yeah.
All right,
Wow.
but don't forget
So we could
construction.
probably go with 7,000.
Well, don't forget this.
Yeah.
It's going to slow down significantly over the next like 3 months, 4 months. So you got to hope for a boom in like April, May, June.
Mm-hmm.
So with the same actual as 20 to 21.
Yeah, I would say that would be realistic.
So that the next for the septic plan reviews would be 6,675.
Yeah, and then
Yeah.
permit to construct would be the same. I would use the
Okay.
same.
11
Bring that over.
Okay. And then we have 500 for daycare.
Yep.
The intermediate inspection, we just very rarely, as you can see in 1718, we did one, and we're usually called out for a special change that's happening in the daycare, like an additional room has been added or something. So that's what that is. So it's
those 2 lines just keep 0 at this point. That's fine.
okay.
13 and 14,
Okay.
those at 0. Licensed salons, we've already discussed that. We're going to use the number of facilities.
Yeah.
Plan reviews. I say we keep that right where it is at that 1095 number.
Okay. Late fees the
Uh,
same.
yeah, you can put that in at the 150 if you want. That's fine.
Okay.
Pools.
Inspection 0.
Yeah, reinspection 0. Pool license keep that at the standard 900 like we've already talked about. Reinspection 0. Child vaccines, keep that at 0. Photocopy, whatever. If you want to put $100 in there, $150, I don't care. That
Okay.
doesn't make any difference to me at all.
Okay. So that's proposed income.
Yep.
So now I'm thinking that we should take a look at the expense side. Now, a lot of this we don't have a lot of control over, because salaries, all of that are decided by the first selectman and
All right,
the
so
finance committee.
let's just make sure everybody's on the same page. Are we on the actual budget numbers where like it has all of the account numbers and stuff on it?
Yep, but I
With
have
the
also,
title at the top.
yep, it says department, health department.
Okay.
Now, I also put together a budget expense detail. It's an Excel sheet, 2 pages.
We're going to look at that in a minute.
Okay. And the reason why I did that is that you don't have a lot of information looking back in the town's department, health department documents. So.
All right, so the numbers, all the contractual stuff, the nurse, the health inspector, all those numbers will just leave all the same. That's all.
Yep. Now on the little cheat, okay, yep, yes, yep. Not much we can do with that, though. That part-time health inspector and nurse hours, those might change because of the position that we're looking for.
Well, we can't. We wouldn't be able to budget. We can't budget for that unless town council says that we can hire somebody.
That's right. That's right.
Okay.
Yeah.
So
yeah.
we can't budget for it if we don't know we can have it.
Yeah.
Okay. So the budget will just have to be modified at a later date with however they do that within the finance people and so forth.
Mm-hmm. Okay.
So I would say that's kind of a moot point at this time.
Okay.
So the next page of that is, I don't know which is page 2 and which is page 3. The next one is like budget health department expenditures.
Yeah.
Health education, does that sound right?
Let me see. It is. Yeah.
Yes, because that's all revenue. That's the last one.
It says on the top, does it say basically budget health department expenditures? Yep.
Yes.
And expenditures in red, yep.
All right, so running down that, all the numbers that you have, in the left column of the this current year, I would bring that right over unless you have some kind of objection to that. Running all the way down to, for the first two, for health education and health office expenses. Those I think are pretty static, and there's not a whole lot of change in them.
All right. So there's a couple things I wanted to talk about. And actually it starts on page 1 and in the bottom box that says budget health department, and then it says expenditures there.
Okay.
Can you see that there? It's
yes.
Okay. It's the department health department on the bottom of the first page. Okay, so there's nothing we can do about salary admin, salary other, salary part-time, health. Then we go to health education. And what that is it's basically money for training for staff.
Mm-hmm.
Okay, so what we'll do is carry that over to 500 to 22, 23. All right, the next to go down to the next step here, the Medicare, there's nothing we can do about that. health consultant fees. All right, so that sheet that I gave you, the expense budget expense detail. What I'm looking for is we still need a facilitator for the strategic plan or money to do it, because I can't do the strategic plan. I don't have the bandwidth given my job responsibilities. And having a strategic plan is part of the 10 essential public health services, which is, you have to, each health department is supposed to have a strategic plan. It's supposed to have a workforce development plan and a community health improvement, community health assessment plans, plural. So I'm trying, and now our community health assessment and community health improvement plans, we have to pay for that. And, that's something that comes along every 3 years. It's the same plan that the hospitals put together. As a matter of fact, we work with Yale and Bridgeport Hospital, and health departments kick in money in order to have this plan put together in our catchment area. So, one of the 3 things that we have to put money in for is that plan. And that plan for the chip and the CHA is somewhere near $3,000. Everybody know where my pen is, where I'm focusing?
Well, the chip, isn't that part, isn't that, I thought that was part of like the memberships and subscriptions area.
Nope, that is under health consultant.
Okay. Well, I can tell you this. I know I've talked to Ken about this before, and we have talked about this before.
Mhm.
At this point in time, I can tell you almost 100% that Ken will not allow that 1,500 to fly. And this other chip money, this other $3,000 that you're looking for, I'm not so sure that he's gonna like that either.
If he doesn't go through that, you're going to have every town that's in our catchment area go nuts, because we pay for it every 3 years for the chip and the CHA.
Oh, well, all right, no, wait a minute. That's the every 3 years expense.
Yes.
Okay, that I do remember. No, I forgot that. I do apologize. But the facilitator for the strategic plan, that I know he won't go for.
See, we have to decide as a board. Like, I'm supportive of a strategic plan, and I'm supportive of being able to have, as part of community health, to have some presenters present. I mean, that's what health departments do. And I'm in a situation where if I don't have funds to do this, then we don't have a strategic plan. And these are things that health departments are supposed to have. These are the underpinnings of a health department.
I understand where you're coming from.
If the board wants to go against that and say, no, we don't want to have one, that'll be fine. It'll get my neck out of the noose for what I feel is a requirement for health departments to have. That's all. And you're right. He may not help, but his thought is, well, Nancy, you can do it. Well, I can't. I have other things that are on the list. I'm only one person. So it makes it, I'm kind of like between a rock and a hard place, And I suppose he is too with the budget. So I shouldn't, I understand that. But I just want the board to make a decision on this so that we can put it in the minutes, so that we can put it to bed. If this is something, you know what I mean, Chris?
I understand where you're coming from. And I certainly understand the need to have the strategic plan updated, because every business needs a plan as to what direction they need to go in. But at this point, I think the better route for us to be going is to try to get an additional employee, and by gaining that additional employee, will then allow you to have more time to do the things as the health director and
Okay.
directing people to do things rather than having to constantly run out and do things yourself.
It's that I agree.
Okay. So, you know, while we all appreciate you being able to, hang up the phone and jump in the car and drive over and do some type of inspection on a restaurant because there was a complaint of this, that, and the other thing, you shouldn't have to do that with any kind of regularity. And due to the size of what we have, that's kind of what you've had to do up to this point. Now, with all of the other goings on with clinics and testing and shots and all this other kind of thing, I think your role needs to be revised to a certain degree, and actually having another employee of the health department, because I think things are evolving, and I don't think they're going to be going back the way they were by any means. It's going to be a new
Right.
norm, as we've all said, and it's going to be more like it is now than it ever will go back to the way it was.
Right.
So it's unfortunately just going to cost us more money as a town, because we're going to have another employee to do the same jobs that we were doing previously, because we have so many other things and obligations to take care of townwide.
Yeah.
So I think that it would be a better sell to not try to uh, uh, get a facilitator and pay a consultant and what have you to try to revise our plan, but certainly more concentrate on getting another employee, which, please believe me, as a taxpayer, I don't want to do that. I don't want to pay more money in taxes, but I believe it is necessary that we have to do this. It's something that the town people should be demanding, as previously stated by Mary and others, that people, the businesses don't believe that they have to be inspected, are not going to be inspected anytime soon, because Board of Health is doing other things. I think that we need to rectify that. And
It's very difficult. And as you recall back in August, I was trying to get on board and really start working on that strategic plan myself. And I went to the Commission on Aging here in town, and had my first meeting with them, and I got some really good information. But to really do any work on a strategic plan is a lot of work. It's not something that you can sit down with one meeting, 2 or 3 or 4, and you've got it. It takes a lot of involvement for somebody to do that. And I just want to be clear that it's a challenge no matter what. We had to hire a consultant to do our first plan, and I was able to get a grant to do it. I was very fortunate. It was like, thank God. But we also need a workforce development plan, and that plan has come due too, and I've got to do that plan. These are huge plans. It takes, if I'm doing 10 food service a month, and it takes about 3 hours, 2 to 3 hours each to do them. So that's 30 hours a month. So
okay,
that's
so
8.
again, I'm going to go right back to what I already said.
It's tough.
You should not have to be doing that many inspections. That's why you have to have people to do them.
Yeah. So really the focus
Really
needs to be on additional staffing.
Yes,
Yeah.
I believe, can anybody else chime
That's
in?
a strategy.
I'm sorry?
And that's a strategy. So the strategic plan needs to have an overarching goal of the strategy that will meet some of the strategy of the town to keep the town health code where it belongs. So part of that is having a well-staffed health department.
Agreed.
And we're like beating a dead horse on that part, but we have to, we have to put in for the numbers and then hope that we can get the people hired to do the work.
Yeah.
So I don't know what anybody else thinks, but I've heard Ken spiel on anything to do with strategic plan a couple of times in the several years that I've done this, and I think that would be, again, beating a dead horse. I think we would be in a much better position to try to attain an additional employee, which would then free up a significant amount of your time, Nancy.
Yeah.
I think that would be a
I don't
far
mean to put,
better idea.
it's a very difficult thing to talk about, because both options are like, you want it to work out for both options.
Of
And
course.
sometimes, and sometimes you only get one or a part of one. And it's well, we'll see. Okay, so I'll put down, I just want to make sure that the board is on board, that the focus is going to be on really working towards getting a staff member rather than a strategic plan.
That would be my opinion. How about you, Chris, Mike?
I agree with you, Chris, because that's really what they need in the long haul anyways, right?
Yeah, I mean, we could put a Band-Aid on it right now, but I think the long haul is to have another employee. You got to have another full-time employee to take care of this stuff, because there's just too many things to do. Any additional thoughts, Chris?
No, I'm with you guys. If it needs to be done, it needs to be done.
You think that same way too, Mary?
I do. But I think that if we're focusing on the budget, that we just have to decide. We have to just know if we want that line item in for the strategic plan person or not. And if we're trying to keep our focus right now on the budget, that's where we have to be looking.
Okay.
So if we're not worried about the strategic plan part because we think Ken won't approve that dollar amount, then let's take that dollar amount out. And if we think that it's important to keep that dollar amount in, then we keep it in. But we need to focus on the budget part for now.
Okay. So the other thing is, I wanted to have a little bit of money for presenters, like at the library. Like we have there's mental health issues throughout the United States, throughout Connecticut, and certainly throughout our region because of COVID and other things. And it's really spiking. And so there's a lot of effort to try to get word out for people where to go, where you can get help. And so things like that, which are revealed in both the community health improvement plans and assessments and all the statistical information that I'm gathering from going to these meetings and such, I just would like to act on it. I don't want to be just, thank you very much for your statistics, and then we don't do anything. So part of, I think, what we can do is we might be able to even get one presenter, or maybe two different presenters throughout the next year to talk on different topics, that being one of them. So what is your thought there? I don't think $200 is a lot of money, but.
Nancy, in the past when there were presentations, for instance, I remember going to the one that the state entomologist did about ticks.
Yeah.
What did that cost us?
We got that one free. And then we had another one at the library, and I'll be damned, I can't think of it. And it cost us $100, but we were able to use the library threw in $100. So these presentations, I try to get other investors in this to help us. So
everything else we're talking about COVID. Are we going to bring a group together at the library for a public service class kind of a thing about one of these? Or would it be something that would be better?
It could be
We
something
can
that
budget for it, but is it realistically going to happen?
I think we could get a speaker that I'd be working with the library on this, where they can do a Zoom kind of call, and that we can have people sign up through the library and to
Or go
attend.
to webinar, yeah.
Yeah.
Go to webinar and go to meet, or
Yep.
go to meeting, or the same platform.
Sure. Yeah.
I'm in for the $200 for that. I think
Yeah.
I think
I
that's
think that's a good idea too.
And just so you know, that 200, if I can get somebody to speak for free, I'll take that first. And if it's somebody more expensive, again, I try to pal up with, the library or senior center. They might be able to have a little bit of money. But in the past, we've never really had a little pot that we can say, hey, we're gonna, the speakers come up and it really addresses a public health concern here in Monroe. I'm always kind of like relying on my nurse to run around to try to give a presentation, and that's not always the best, because they're not necessarily the specialist to talk about mental health issues. So anyway, I don't mean to drag on, but I just want to say thank you.
Yeah, let's leave the 200 in there. I think we're going to take the 1,500 out for the planner.
Okay.
We're going to leave the 3,000 in there for the chip dues.
And it might be a little bit less. I don't have the final dollar amount. That's a guesstimate. Yep.
A little less is better than a little more.
Yep.
So that the chip and cha for the 3,000 for the every 3 years is good.
Yep.
All the office supply stuff and toners and stuff, that's the exact same. We'll go with that.
Yep.
The
only difference that I added was environmental health supplies. And this comes down to, if we're going to hire somebody and it's a sanitarian, that might also help us with emergency planning. I mean, that would be another way that we could work that around. They still would need equipment and supplies, a to-go bag if they have to respond to an area, So that's why I've increased that line item by $300 for that reason.
Okay. All right, I'm in for that too.
Yeah, I think everything else is the same.
Everything else seemed pretty good to me. I just had the only thing that I had thought of was that the strategic plan thing, which I know just is definitely not going to fly. That's just going to get an X right through it.
I got it. Okay.
Everything else, I think I'm real good with, Nancy.
Okay.
Is there anybody else that has any thoughts? Chris, do you have any other additional thoughts about anything we have talked about budget-wise?
Nope.
Mary, any additional items?
No, I'm good.
Okay, Michael.
I am also good.
Okay, so we're going to go ahead and obviously, Nancy, you've written down everything we've talked about as far as actual numbers, bringing them over on the budget comparison and that sort of thing, correct?
Yep.
Okay. So we're going to bring the budget to a vote. All in favor of, excuse me. I motion to accept the budget as we have already discussed with the corrections and removals and additions that we have already previously discussed throughout this whole entire thing.
I second.
Okay. And Michael? Okay. Okay. Chris, your vote?
Aye.
Mary?
Aye.
Okay. Nancy?
Yes.
Okay, great. So the vote has carried unanimously. Our budget will be as amended as we have already discussed. now I've lost my agenda, so I have no idea where I am.
That might be the last thing. Let me see.
Okay. All right. So the last thing was the board meeting dates, which we have already discussed. Okay, so I think we're actually in good shape. So for our next meeting, Nancy, please look into the couple of things that we have talked about, as well as really trying to stress and find out if it is possible to really push forward for an additional full-time health employee
Okay.
to help with inspections and any other types of clerical things that we need done, you know, through, like, in essence, basically another full-time sanitarian,
Yep.
which can certainly help out in a lot of different ways.
Yep.
The other thing would be, you know, you're looking at a part-time nurse or a per diem nurse, a part-time sanitarian, and you're talking about some of the things that you're doing making up for the nurse. I don't know what the workflow is within the office, but might it be that if another clerical person could take care of some of the clerical things that those who are doing it for themselves are doing, like if some of the clerical work could be designated, an assistant to Barbara doing clerical stuff could take care of clerical so that the people that need to go on site could be on site.
There's very little clerical to do because,
Okay.
yeah, it's that's not where the solution lies.
There's
there.
not stuff that can be delegated out.
Right. So some of the challenges, Mary, too, are that, okay, I have to think about what's it going to be after post-COVID. So after post-COVID, do we need a full-time nurse? Do we need a full-time sanitarian? And so if I were, looking back at just a few years ago, I would say that we don't need a full-time nurse, but I would say we could use more than an 8-hour nurse. And I would still, and now because of lots of changes with emergency preparedness and all these other plans coming that are due, you need a full-time sanitarian to pick up the part-time sanitarian work, just fold those hours into the full-time position, and hire a full-time sanitarian that can also help with emergency preparedness. That's the only way that I can really see how it would work, so that you can address issues that are now as well as after COVID. At least that's my thought. So if anybody has anything to add, I'm all ears.
Well, you're certainly the best person to be answering that question because, you know, we're not there. We're not part of the workflow within the office. So if you say that that's the best way to go, it kind of seems that way on the surface to me as well. I certainly encourage you to, have these discussions with Ken as well, to get his take on it. But that kind of seems the direction we need to go as a board, and as the whole entire health department.
Yep. Okay.
Okay, so at this point, it is 8:07. I am motioning to adjourn our meeting for this evening.
I'll second it.
Second.
Okay. And Mike, Chris, Mary, ready to
Aye, aye.
adjourn? Okay, great.
All good.